All right, looks like we've got just about everybody here. Welcome, everybody. My name's Tim Gillette. I'm the Chief Operations Manager for both the Child Welfare and the Self-Sufficiency programs. I use he, him pronouns. And before we dive in, just a couple technical things to cover. We do have live captioning today, as well as ASL. So if you're utilizing those, hopefully we'll be able to see those on the screen. We're also recording, and we'll send out the recording to anyone who registered for this event. We are going to be sharing some slideshows today. So if you're utilizing the interpreter screen, make sure you pin that window so that when we share our slides, that it doesn't shrink down too small for you. We are looking forward to hearing from you. The way that you can interact with us, there's two ways. One, if you want to leave a general comment in the chat, we're happy to see those. If you'd like us to see a question of yours, we do have a Q&A function. So any questions that you'd like to get answered directly, please leave those in the Q&A function as opposed to the chat. I think we're just, you know what, we have a few questions that we're going to cover first. And then if we have time, we'll try to get to some of the questions in the Q&A if possible. So I think we're ready to get started. I'm going to throw it over to Rebecca.
Thank you, Tim. Good afternoon, everyone. My name is Rebecca Jones Gaston, she, her pronouns. I am the Child Welfare Director and happy to be with you today. I actually wanted to provide a little bit of update on what's going on with me. As many of you know, I have been nominated by President Biden to serve as the Commissioner for the Administration for Children, Youth, and Families. I had my first confirmation hearing in front of the Senate Finance Committee in February. And I am happy to announce that I've been favorably voted out of committee. And what that means is that we're just waiting on the full Senate to have a vote on my confirmation. That's going to take a little while, not surprisingly. And just really wanted to continue to keep people updated on what is happening related to my nomination, and then what the plan is for when, and hopefully that I get confirmed, the plan for Aprille Flint-Gerner to be stepping in as the interim director once I depart Oregon. But again, that's not going to be for a little while. And I'm happy about that and have lots of opportunities to continue to work and partner with you. We'll keep you updated. And, you know, until I transition over to my next role, I continue to be all in as the Child Welfare Director, and I'm honored to serve here amongst all of you and with this team. So thank you very much. I'm going to turn it over now to Aprille.
Thank you, Rebecca. Aprille Flint-Gerner, she, her pronouns, Deputy Director with ODHS, Child Welfare, over Equity Training and Workforce Development. As you heard, we still have more time with Rebecca, and that is great news for us. As we prepare for her eventual transition, fingers crossed, we want to thank you for your continued support and partnership as we continue the momentum of putting our vision for transformation into action. So I wanted to just kick us off on some updates related to our legislative short session. We're going to talk a little bit about some updates with our Oregon Child Abuse Hotline. We're going to talk some about our family preservation kickoff later this month. So first, I want to talk a little bit about kind of the overall what happened in the 22 legislative session related to child welfare. We tracked a total of 53 bills during the 2022 session. Of the 53 bills, 23 bills passed with emphasis on a comprehensive rate structure review across child caring agencies, workforce retention and recruitment efforts for behavioral health treatment providers, grants to support the reduction of youth homelessness, the appointment of child support referees operating from a centralized process, and enrollment in a central background registry for individuals employed or volunteering in preschools or school age recorded programs, or preschool recorded programs as well. I want to talk a little bit about a few of the significant bills that we were tracking. So House Bill 4012 is relating to children's services, provider compensation, and prescribing an effective date. And so 4012 supports a unique opportunity to look at particular levels of care within Oregon's child service array, including our psychiatric residential treatment, our psychiatric day treatment, substance use disorder residential, intensive in-home behavioral health, and behavioral rehabilitative services. So this rate study will take place in the coming year through a collaboration between ODHS Child Welfare and our Oregon Health Authority and Oregon Youth Authority partners. The goal of this is really to move towards a structure that reimburses for actual costs. So we're looking forward to that work moving forward. Next, I want to talk a little bit about Senate Bill 1547, and that is related to enrollment in a central background registry. However, clarification around secure transport is the portion that really impacts child welfare. And so this really defines secure transportation services for purposes of child caring agency licensing. And it clarifies application of secure transport regulations that were established in Senate Bill 710 from the 2021 legislative session. And it exempts ambulances and other travel that was captured inadvertently. Next, I want to talk a little bit about House Bill 4013. So this bill relates to youth homelessness, and it expands eligibility requirements to include unaccompanied homeless youth. It also establishes a pilot program to assist school districts in preventing student homelessness. Additionally, it expands tuition and fee waivers available for current and former foster youth to include current and former homeless youth. It also appropriates $750,000 to ODHS to implement new provisions for homeless youth to access independent residence facilities. And 4013 appropriates 1 part-time administrative specialist and 2 positions to carry out provisions of the bill. Next, I want to talk a little bit about House Bill 4005. This extends the date for transition of the Early Learning Division to Department of Early Learning and Care. So just yesterday, our Governor Kate Brown signed House Bill 4005 with a $100 million child care investment package at Bloom Children's Center in Bend, knowing and understanding how critical investments in early child care are for Oregonians. So that was kind of a quick overview of this last session. In terms of looking ahead for 2023, 2025, there are still a lot of unknowns in the year ahead. We know that we're going to be moving into a gubernatorial race and getting a new governor and new legislators. So these are areas of our work that we're exploring, but many things could change from now until the 23-25 session. However, we want to continue our cross collaboration with ODHS and our other partner agencies and partners such as yourselves to ensure we're not working in silos, that we're providing holistic care and opportunities for children and families. And we want to continue to protect and honor the identity of the children and young people that we're working with, particularly our LGBTQIA2S+ youth and families. We want to develop more pathways for our resource families beyond an assessment. So if we do an assessment and it's something else that they need, mental health services, access to affordable housing, et cetera, that we're able to do that, and how we're connecting them to those resources. And Then we want to work with our state partners on how we can get more access to childcare for our families, our biological families, relative kin, and resource parents. So that's just a kind of a snapshot of some of the things that we're looking forward to in the next legislative session. Right now, I'm going to turn it over to Lacey Andresen, the other Deputy Director, to talk about our Oregon Child Abuse Hotline. Lacey?
Thanks, April. Good afternoon, everybody. My name is Lacey Andresen. My pronouns are she, her, and I serve as a Deputy Director for ODHS Child Welfare Aligning Program and Practice across the state. And I'd like to spend a little time with you this afternoon talking about the efforts that we continue to make around improving the experience for Oregonians when they interact with our Oregon Child Abuse Hotline. The vision and mission of the hotline is to really engage our community, including those who are mandatory reporters, and respond to reports of child abuse in a transparent and clear way. And we want to do that while we're ensuring that children and youth are safe in their own communities. We receive reports of abuse and strive to provide excellent customer service with equitable and consistent decision-making. You can see the number on the screen, 855-503-SAFE. We serve as a 24/7 hotline. We operate 365 days a year. And that toll-free number is a way for you to report allegations of abuse against any child or adult in the Oregon Department of Human Services. You can also report abuse by contacting law enforcement as well. You'll see on this next slide what trends for the number of contacts have looked like since centralization. That first line at the top, the dark blue line, is the numbers for the year 2019, and the months are across the bottom. We started collecting data statewide in April of 2019 because that's when we centralized a total of 15 hotlines that had operated individually across the state into one. And at the time we did that centralization, our capacity around tracking, evaluating, and reporting on data increased dramatically based on the software that we purchased. So that's why that starting date, there's no data prior to that, because the 15 local phone lines didn't have the data availability that we have now via centralization. So you can see over the course of that year, much like what some of our national technical assistance partners and what we heard from other states experience, that we saw an increase in call volume as word got out about centralization. And then the red line shows us the trend for the year 2020. As many have discussed and talked about, you can see a significant dip in the number of contacts that happened to the hotline from March really until it stabilized around June. And that was at the early onset of the pandemic when, children, young adults, and everybody really went home, stayed home, and there wasn't as much contact with children in the public. And then we saw it stabilize over that year. And then what we hope to see is kind of the ongoing trend. That purple line right there in the middle is 2021 data. Just overarchingly, trends that we know and see in terms of number of contacts to a child abuse hotline, they tend to rise during the spring and fall seasons, and then we see a lower number across the summer months. Currently, primary reporters to our hotline are law enforcement, employees in school settings and educational settings, mental health and medical health providers, and ODHS child welfare employees make up the highest number of people who call the hotline to make allegations of reports of abuse or neglect. In 2021, 40% of contacts received at the hotline were not documented, meaning they weren't allegations of abuse or neglect. And while that number is still high, in 2019, it was 48%. So that accounts for some of what you see as a higher total number. And that means people are learning when to call their local office, when to call other supportive agencies, and then when they're making an allegation of abuse or neglect. On the next slide, you'll see some interesting trend data over time. This is just the past 6 months, but as you project even further back, the patterns stay the same. And what you're seeing here, that large blue block represents the total number of reports. Across the bottom is each month, so from 6 months back, so September 2021 on. So that's total number of calls. Way down in the pillar, you'll see the purple line. What those numbers represent is the number of founded allegations of abuse or neglect that happened in that month. And then that very bottom line is children who had to enter foster care as a result of the allegation of abuse being founded and our inability to maintain their safety in their home. One takeaway for me from this data is that while sometimes there's a flux in total number of calls, you can look and see the pattern of founded allegations of abuse in children who need to enter foster care staying really consistent. And this indicates to me that we're reaching the families, the children who need our intervention, and we're reaching them really consistently. Next slide, please. So over the course of the last 3 years, our team at the hotline has been under continuous review of their data, looking at evaluation and performance, working on ways to improve the experience, the consistency, the fidelity of assignment. And we continue in that cadence of planning for strategies to improve. So we have currently short-term, midterm, and long-term strategies. And we'll start with talking about some of the things that are happening right now in the short term. We've done some adjustments to the tree, to the phone tree, and to the queue. One that we've done based on the data analysis is to take medical and mental health providers, the medical communities now have their own queue. We use data to inform that decision because we looked at the evaluation of outcomes related to CPS assessments, who are the callers and who are more likely to be reporting allegations that ended up being founded. And medical and mental health providers definitely fall within that category. So those are balanced at the same urgency as law enforcement. We've also done some changes in expectations for screeners and staff, just about the way they manage their workflow, how they answer the calls in the day, how much time they take between calls. We, alongside what feels like the rest of the state, continue to work through workforce support issues. And so we're in a constant cadence of hiring, onboarding, and training for our vacant positions. And then also doing some analysis, increasing the capacity within current staffing about who can answer the calls when. And then finally, in the short term, we're working on some capacity for electronic reporting for designated ODHS staff. You heard me state in the last slide that child welfare employees tend to be a high number of calls to the hotline. So we're working on ways for them to submit those reports electronically instead of needing to call into the queue. You'll see from the next data presentation some of the impact that the hard work of the team at ORCA is having on wait times. And this display is 2 sets of data. So we'll start with the axis, the y-axis on the left. That shows average wait time by minutes. And then the different color bars, although they're quite small on this display, are different types of callers and what their average wait time is. So you can see, for example, in late 2021, that gray bar is mandatory reporters. The orange bar is medical and community, and those are only in 2022. The yellow is general population. And so in the end of 2021, you can see that those average wait times trended high, which means we know that on each side of that factor, there were some that were lower than that, but there were some average times that were longer than that. And then you can see as you move into 2022, as the team has implemented some of those strategies I just described, there's a significant reduction in wait times. And so over the course of the last 2 months, the trend is very clear that the wait times are much shorter than they have been. The other half of this display is on the y-axis on the right. Those are percentages. And you see that green line. The goal that the team has set for service level is 4 minutes or less wait time for all calls to the hotline. And those green the green dots and the green trend line shows you where we are in terms of the percentage of callers who have that 4 minute or less wait time. Again, late 2021, we were down in the 15 to 20% area. Most recently, we've been trending between 80 and 90% of callers to the hotline are experiencing a wait time of 4 minutes or less. So those improvements that the team is making at ORCA are clearly working in terms of how we are looking at the data for wait times. We're going to continue in the mode of seeking to make quality improvement adjustments so that the hotline continues to serve better, more efficiently, equitably, and timely. And some of those midterm strategies that we're currently working on, the first is the implementation of structured decision making. This is a screening and assessment tool that guides a screener on how to collect and analyze information in order to make a determination of assignment for an assessment of abuse or neglect. And then to support that work, we're working through making changes to rule and procedure and practice. And then finally, really looking at increasing access to training for mandatory reporters. You heard me say earlier, we still have a lot of people who call the hotline and end up having calls that don't result in an allegation of abuse or neglect. So we want to make sure, especially for our mandatory reporters in Oregon, that folks know exactly what is the definition of abuse or neglect and then how to report that. And so we're just looking at all the places where we can get that information accessible and available to mandatory reporters. And finally, we have some long-term strategies in place as well. We're going to continue to work on the technology to support the screener inputting the information and getting it into the system. We're in the middle of a shift. And so right now there's some duplicity between the two systems where they're entering information while we're building out the modules to support the final product. And that will be a way that will take less time for screeners to actually enter the information. And finally, looking at the capacity and possibility around what it would take to get to online reporting for all mandatory reporters, or some mandatory reporters. We're just thinking through that so that they can just submit the information online versus needing to wait on hold on call. But that will take some bigger strategies and long-term conversation. I continue to be really grateful and pleased with the team at ORCA. They use the vision for transformation and all three guiding principles. You just heard me reference some of them in how they look at the work, how they show up to do the work, and continue to just be open and nimble to improvement. And you can see from some of the data I just showed you that they're really moving the mark. So we're excited and grateful for that team. The other update from me is specific to family preservation. We are in the month of March and looking forward to the family preservation demonstration sites having a huge kickoff. The date for that event will be March 28th. We continue to field many questions about the program, what's changing, how ODHS programs are working with community partners and folks with lived experience, and how the work will support families in those sites. And so the kickoffs offer opportunities to communicate about that, to look at what we're going to be focusing on. And we're going to do 3 throughout the day, highlighting one of each of the demonstration sites per day. And then also we'll have time for some question and answers during those sites. Our key audience for the 3 kickoff events on March 28th are the child welfare staff, the self-sufficiency staff, and community stakeholders and providers and people with lived experience in each of the 3 key areas where we're going to be doing the initial implementation. Others are welcome to join and listen in, but that's really who we're targeting on that date. The times are going to be 10 to 11:30 on Monday the 28th, with the focus area being the Alberta branch of Multnomah County. And then in the afternoon, we'll host the event from 1 to 2:30. With the focus being District 6, that's Douglas County. And then finally, later on in the afternoon, 3 to 4:30, we'll host the kickoff for District 11, that's Klamath and Lake counties. And again, all are welcome. We're really hoping that our teams and the community stakeholders involved in this work will be able to be present for one of those 3 times on that day. And in each of those sessions, you can expect to hear from self-sufficiency program and child welfare program executive leadership, local leadership in those 2 program areas, staff, and families who've experienced our system. And we will be following that up with some time for question and answer as well. With that, I'm going to hand it over to Alysia to talk about some CQI updates.
Thank you, Lacey. Good afternoon. My name is Alysia Cox. My pronouns are she, her, and I'm the Deputy Chief of Strategy and Innovation for Child Welfare. And if this is your first time listening in on our community chats, or this is your, I believe, 3rd or 4th time, I can't remember how many we've had, but I hope that you can tell by our excitement and continued passion around improvement that it's palpable and that we're continuing to do the work as we bring the vision for transformation to life and into action. Specifically for guiding principle number 3, it's building our transformation on data-informed practices and modernized information technology and tools, which means increasing our capacity to look at data and information to inform those strategies and decisions, as well as making sure that we're measuring the progress so that we can see the intended outcomes and the movement towards that improvement. As part of our end of year kind of capture of all the accomplishments and successes of child welfare, I do want to highlight the launching of our public dashboard. I know we mentioned it several months ago, but I do want to bring it to the forefront because as part of our data practices, which is all the actions leading as part of the data cycle, that is the planning, the collection of data, the access to data, the analysis of the data, the use of statistical tools, algorithms, reports, dashboards, all the different ways that we use data to help inform our decisions really will start from having access to it. So I'm very excited to say that the dashboard is really building out the transparency and where we are with our current state on our federal measures. So when you click on the link and you access these dashboards, you can see where we are within the last quarter. Previously, we've only had access to our reports, our federal reports on an annual basis, and that could have been the year prior. So we're looking at 2 years old data. And when we're trying to be transparent with the work that we're doing in our current state, we can know with certainty that our improvement strategies are changing those outcomes in real time. So as we continue to look at different iterations of our dashboards, get feedback from you all about what information you need as we build out our data literacy, data access, and data improvements, we're going to get there together. And I continue to be invigorated by the work and working together on ensuring that the data that we enter our systems are accurate and that the fidelity of our data is giving the report that we need. And if we don't have access to that particular measurement, it's figuring out how can we have access, how can we define it so that it's reflective of the work that we're doing and the improvements that we are doing. As part of the improvements for our continuous quality improvement or CQI program, we received the policy option package, which included positions that we're now being able to recruit for and going through the interview process. So I'm pleased to say that we've hired a manager, a project manager, and we're working towards our quality improvement analyst to ensure that it's reflective of the design and delivery work that we're doing, that we have continued collaboration with our tribal nations, so we have tribal representation on our team so that we can get to have true consultation and collaboration with our sovereign nations. And with these positions to really build out the recommendations so we can see the changes and improvements in our federal measures. So when I come to you in 6 months, 9 months, and 18 months, we're going to see tremendous change in those particular areas because we have concerted efforts that will document and demonstrate the improvement. So very excited on the forefront. We're at the helm of some really great data improvement changes, and I'm excited for all of you to join us. I will pass it over to Aprille for our Q&A portion.
Thank you, Alysia. This is, again, Aprille Flint-Gerner, she, her pronouns. There were a few questions that came to us prior to today, and so wanted to make sure that we covered those as well as that we have some possible time for additional questions. So question 1 was, I don't believe that child welfare got the local equity positions that we asked for. So wondering if you're still able to prioritize community-based work and if local partners can help. Also, did child welfare's community engagement program get funded? So it's kind of a 2-part answer. So the local equity positions were not directly a child welfare initiative. They were intended to be positions that were connected to our Office of Equity Multicultural Services team to support all of ODHS. So child welfare still has a position related to service equity that will be joining the OEMS team. And that role will continue to work specifically, or will start working specifically on child welfare priorities related specifically to tribal and community engagement and system improvement efforts. And so we're going to be looking forward to that recruitment. That said, We also know that our local leaders and staff are at the heart of building relationships and connections with our communities, and that focus is not going to stop. We're continuing to have conversations with our district leaders, our branch leaders, to continue to focus on the intent of that community engagement ask. We are moving forward. And there's always room for community support as we create a stronger family well-being system. And so our local partners and our system partners, like many of you that are on with us today, who have been involved in things like our CP3 project and Thriving Families, Safer Children, we're creating these collaborative opportunities to help families before they come to the attention of child welfare and prevent, the need for us to be overly involved and really participate as a part of the child caring system to really support families. And so we're going to continue to advocate for the infrastructure that we need to support equity and community engagement. And so ODHS is going to continue to rework those asks into future opportunities. And then I wanted to just give a minute before Lacey answers the next question. Maybe you can talk a little bit about Thriving Families, Safer Children effort kind of connected to this question. Lacey.
Yeah, so I have a couple of things I would say about that. One is Thriving Families, Safer Children is a national practice that we're participating in as a state. We're the second wave of states implementing Thriving Families. And it's really the agency's effort to help set the table for community to determine what families need without needing child welfare at the table to facilitate, to fund, but really pushing it out into a community effort to say, what can we as a community do to meet the needs of children and families without needing to have child welfare involvement? So lots more to come about that, but I would point to that specifically as an equity effort because we know that historically marginalized families that come to the attention of the agency aren't treated fairly or equitably. And so really keeping us out of it whenever possible is really going to drive toward more equitable outcomes. We're also talking about, as we talk about family preservation implementation and continued work around alliance to the spirit of ICWA and our ICWA compliance implementation, that those two are equity efforts because it is important to us that we serve all families fairly, equitably, and equally, and infusing that in the practice of the work rather than having it be something separate that someone else does is a really important component to really moving forward with truly equitable outcomes for all families that we serve.
And this is Rebecca. I wanted to just chime in along those lines and just say, if there are community partners, community members that you're working with, and they want to get engaged with us or want us to be engaged with them, however you phrase it, please send them our way. And we would love to meet folks in the community and then work on how are we at the state level and the local level going to build partnership and relationship with organizations and communities. So I wanted to just call that out also and solicit any input and suggestions and connections that you might think are important for us to be making in this effort to really be driven by community and those that are experiencing our system.
Thanks, Rebecca. The next question that we received was about the demonstration sites for family preservation. How long will the family preservation demonstrates be in demonstration mode before being implemented statewide? And how can the community stay involved in finding out lessons learned? It's a great question. We're really working our muscle around implementation science. So in the true spirit of demonstration sites for implementation, I can't give you for sure about how long it's going to take. What we expect is that over the course of the first weeks and months, as we're working on implementation in the 3 sites, we're going to get lots of input and feedback from staff, from community stakeholders, and from people experiencing our system about where we need to adjust, where we need to change training or guidance, where we need to change protocol and procedure. And then over the course of, the process of implementation, once we see that it feels like we've reached some homeostasis, that we've gotten to what's working well, then we'll be looking to where else in the state we'll move family preservation and how quickly. We'll consider some things like leadership readiness, the makeup of the community in selecting those next places to go. And in terms of y'all staying connected to the work, we have both the statewide team that's working on it, but also each county has a local implementation team. So if you're not yet connected and interested, let us know, and we'll make sure that you have contact information for those folks so that you get to find out what's going on in your community if you're in a demonstration site, or if you're interested when it comes to your area as well.
So Lacey, Rebecca again, do you have any updates on where we are in the recruitment and hiring of the family preservation manager?
I do. We have identified and selected a candidate. We are going through the clearance process and the background check that is always required to move within our agency. And so I'm not yet at liberty to report, but we're very close, and I anticipate within a week or two a statewide announcement going out about who's been selected to serve in that role.
Aprille, I believe the next question is yours.
It is. I was just coming off mute. Thank you, Lacey. We are certainly excited about family preservation and sharing with you all as a community how things are going and ways that you can continue to learn alongside of us. Our next question is, what is Oregon Child Welfare doing to protect trans children given recent passed and proposed legislation across the country? I'm glad you asked. So Oregon Child Welfare, as well as leadership across ODHS, we stand in support of trans children and gender fluid and gender diverse children and young people and their families, including those who are experiencing foster care and those who have previously experienced foster care or who've been adopted. We strongly support providing affirming care to all children and youth, including those who are trans and gender fluid. Some of the things that we're doing in child welfare to continue to support trans and gender fluid children and youth are partnering with our partners at KEEP for our LGBTQIA2S+ affinity groups for resource and kin families. We have staff with lived experience and expertise that are dedicated to advisory groups and working with us to continue inform how we prioritize the needs of our children and young people across the SOGI spectrum. We have a focus on recruitment efforts for our resource families who will affirm children and young people in their identities, including children who identify as trans and gender fluid. And child welfare remains committed to dismantling barriers to good outcomes for all children we serve, creating pathways with those with lived experience to influence the ways that we serve our diverse communities, and increasing a sense of belonging and affirmation for every child and family that we serve. It's our duty and responsibility to affirm children no matter how they identify, and to make sure that we are partnering with our child serving community to make sure that we're all doing that together. And so we really appreciate the question and an opportunity to restate our commitment to serving all of our children, and particularly our trans children and those that are gender fluid in our system. Alysia, I believe you are up for the next question.
Thanks, Aprille. Alysia Cox again, she, her pronouns. And the question is, what are some current ways to engage with the work of child welfare? Well, there are usually quite a few opportunities that pop up, and they will be posted in the community page. Currently, the Continuous Quality Improvement Advisory Group is looking for members with lived experience, community members, data-minded individuals, or you're just interested in child welfare improvement. The committee is really broken out to 3 deliverables over the course of time. Between now and July, we'll be developing the vision and the data equity strategy plan. Phase 2 will be the implementation of the CQI program, or Continuous Quality Improvement Program, which will be from July of this year until July of next year, 2023. And then phase 3 is the sustainability and support of the CQI program. So this would be ongoing and to provide the feedback and guidance on the strategies. So if you're wondering what the data equity strategy plan is, it's building out what is our intentions as we build out the program so that we have some transparency and we're using our data in an ethical way and that we're using it for decision making. So as we get strategies from districts across the state, as we're working with our quality improvement analysts and they're coming up with proposals on the type of strategies and improvement methods, are we being mindful of the inherent bias that we may have in our data? So having a data equity strategy plan as it pertains to the vision for transformation allows us some guardrails and some structure in how we ask questions about who is at the table, how is this data going to be impacted? Are these strategies right and appropriate for this particular area? So having persons from a wide range of professional and personal lived experiences as we build out our data equity strategy plan is going to be integral into the success of our quality improvement program. So if you're interested, we have some opportunities in intake form. The dates will be listed. It's the second and fourth Thursday of every month. And going forward, those times will be recalibrated based on who's available and who's able to participate in the committee. So I hope you're interested, or at least come in and pop in and see if it's something that you're able to contribute or interested to listen. I do welcome everyone. Thanks so much. And I will pass it over to Aprille. I think you have the next question.
I do. It's Aprille again. So the next question is, aside from traditional training, what is child welfare doing to support staff and continue workforce development? I love this question. We know that workforce development and retention of our workforce is crucial to our system transformation. And we have been really focused on increasing engagement and support for all staff and building our infrastructure to do that, both for our staff and our resource families. So we've been building out a central office training and workforce development team based off training and workforce development best practices with the intent to leverage our new positions to help us build more supports for pre-employment activities like internships, paying special attention to standardizing our curriculum and training standards with our Portland State University partners, making sure that we have clear expectations around excellence in training, growing our ability to partner with Alysia's CQI team for rigorous evaluation and improvement cycles for all training and workforce development approaches. We've also been working with the Capacity Building Center for States out of the Children's Bureau to start the foundational work for the launch of a statewide coaching model. I can't wait to come tell you all more about that as the days progress. And we are looking at growing beyond stand and deliver training to increase our ability to use opportunities for transfer of learning, not about what's happening in the classroom, but what's reinforcing skill development outside of the classroom and after the classroom, so that we're continuing to do, grow the confidence and competence of our workforce over time. Some of those things are kind of specific, like increasing our use of things like micro learnings and rubrics and simulations and other skill building opportunities, focusing on promotional readiness and leadership development opportunities for all of our staff. So we are really excited to be in active recruitment currently, and we will keep you posted on our progress with our expanding our capacity for the full range of workforce development opportunities. If anyone has talked to me about workforce development, they know I can talk all day about it. So with that, I'll be brief. And I believe that we are going to open it up for some Q&A, and that I am going to be turning it over to Lacey, I believe.
And Rebecca's going to chime in pure Rebecca style. And Aprille asked a question of you, if you could just talk about building on what you've discussed related to workforce development for our workforce. Can you plant some seeds about also how we're looking for opportunities to develop and learn with our partners in the community and our partners that are also helping serve children with us.
Yes, I think some of the things that we're thinking about, related to Family First implementation and the launching of our family preservation sites, there's so many opportunities to think about how are we sitting in classrooms together? How are we sharing resources? If we've got, for one example, motivational interviewing, something that we're going to be talking a lot about. And we know that motivational interviewing as a part of our prevention plan is going to be cross-cutting across our service provider community and our workforce. And so why would we need to reinvent wheels, right? We're going to be looking at opportunities to have blended classrooms and create opportunities for staff across our state and whoever they're working for, or our partners, to really be in learning spaces together. And so we're really going to be looking forward to listening to you, hearing your ideas about, where are we kind of flipping the classroom also. It isn't always about having an instructor in front of the room that's the expert. Quite frankly, I'm so excited about the conversations that we regularly have with folks on our Parent Advisory Council, for example, who are the best suited in some ways to be able to help stand in front of our workforce and our resource parents and talk about their experiences and what good practice looks like to them. And so how are we creating those pathways to make sure that we've got lived experience in the training room, or that we've got videos that are going to be coming out talking about our, introducing our new resource family training series that are highlighting voices of those with lived experience. So I think whether it's sharing space in the front of the classroom or it's having participants that are coming from many places and spaces learning together, I think there are just so many opportunities for us to continue to partner as we talk about growing the skill of our entire collective kind of workforce and community around children and families.
Thanks, April. I wanted to address a couple theme questions that had come in while I was doing the presentation about the ORCA data. The first was around abandoned calls. So people who are calling, are waiting, and then hang up without having spoken to someone. And we do track that and pay close attention to the number of abandoned calls that we have. Overall, as goes wait times, so goes abandoned calls. So as the wait times are higher, we tend to see more people that abandon the call and call back, and vice versa. When wait times are lower, there's many fewer abandoned calls. We're not able to directly correlate whether or not the person who abandons calls back, but it does when there's a high rate of abandoned calls and wait times, the number of calls are higher. So what we believe is that folks hang up and then call back at a different time or directly after, hoping to be able to reach someone more quickly. So definitely something that we keep an eye on. The other question was around the data that I shared in terms of number of contacts to the hotline, number of reports, and then those that are founded and where we have children removed. And the question was, do we pay attention to that data disaggregated by race and ethnicity? And the answer is yes, we do. It's the one key component to know about that is that the caller has to know and correctly identify the race and ethnicity of the family that they're reporting to the hotline. But we do request that information and collect it, and then pay attention to outcomes for families by race and ethnicity specifically.
I'm sorry. I was trying to read the questions in the Q&A and I couldn't click on my mute button. Rebecca again. I want to just offer just some reflections and again extend the invitation for you to reach out to us and have one-on-one conversations, or if there are spaces and places that your organization, your community partners that you're connected with, or you're a member of a community and you want to find out how to get involved with our work and the vision for transformation. If you want to create space for us to hear feedback and input, so that we are considering that in the conversations around legislative concepts, policies, procedures, the development of family preservation, all of the things that you've heard us talk about today and in other spaces. I also just really want to, acknowledge that these last 2 years have been pretty extraordinary in a lot of different ways. And the ability to be able to come and meet people in person and see all of Oregon, I know is something that this team is very excited about. And again, just ask if you have ideas about where we should be going to meet with community, to see the work that you're doing, to also have opportunities to get feedback. Just let us know. And as we are all moving towards the end of this month, we've got the mask requirement has been lifted. As we start to be able to interact with each other in person more and more in our offices, out in the community with each other, I just, my ask of everyone and my hope for everyone is that we really extend grace and kindness to each other. I know for me, I'm a little nervous about what it means to be in a room full of people again. And I also know that before 2 years ago, I loved being in a room full of people. And so just, the work that we do is so important, and it's really hard, but it's so critical that we're treating each other with kindness and with compassion and understanding, and finding new ways to work together. We've learned a lot in these last 2 years about how we could do our work differently, how we need to do our work differently, and renewed passion I felt about really wanting to have an impact on the communities that we're serving as a community member, and not just as a department of human services. And so I thank you all for the commitment that you have made to all of the work in the communities that we all live in. And just thank you in advance for the continued partnership and opportunity for us to continue to work together as we're serving on behalf of children and families here in Oregon. Our next community connection is going to be in May. And I just encourage you, send us topics, questions, things you want to know. And down the road, we're going to figure out how we do some of these in person so that we can practice our MC work. I always like to say my Oprah side of my personality, to run a microphone up and down an aisle, but really just look forward to being with you in community as we strive to really help those that we're serving and each other be well, be healthy, and really continue to have the connection that's so critical in this work and in this world. So I just thank you all. Take care of yourselves. We look forward to hearing from you. You're going to get emails with a survey to fill out and give us feedback. You're going to get some follow-up emails with the PowerPoint materials that were shared today, as well as the link to the recording. And so hopefully you can share those with others, and we look forward to seeing you again soon. Take care, everyone.